Thank you so much for joining us on this episode of Family Matters. My name is Purity Museo. We continue with our conversation on coronavirus epidemic. Of course, we've been talking about the virus, the number of cases being confirmed globally, and also the number of deaths. But tonight, we are talking about two additional cases that were pronounced today by His Excellency President Uhuru Kenyatta. Now Kenya having 3 confirmed cases of coronavirus. And of course, we will continue with our conversation on how to prevent further spread of this virus that has so far claimed up to about 6,000 people globally. Once again, I'm Purity Museo. Welcome to the show. To help us with that discussion, next to me is Dr. Rudi Eggers, who is the WHO representative for Kenya. And of course, Dr. Rudi will be giving us a global perspective. Rudi, I do understand that other nations, let's say WHO did declare Europe as a new epicenter. You'll be telling us what especially China is doing to reduce the numbers, because the number of infections that are being announced every day are reducing day by day in that particular country. Then at the middle is Dr. Philip Muthoka, who is the coordinator for the National Influenza Program. And of course, we know this is the biggest program when you talk about preventing and of course dealing with any suspected cases. Those that program, he is the one who is in charge of that particular program, who will be updating us on especially some of the heightened surveillance that the government is doing now that we are talking about more cases and others in quarantine. Then at the far end is Alfred Obengo, who is the chairperson for the National Nurses Council of Kenya. And of course, we do understand that some of these cases, they are being referred to different hospitals. Mbagathi Hospital, there is an isolation center. And the first people are coming into contact with are actually nurses, health professionals, community health workers. So he will be giving us what are some of the encounters that the nurses have as they deal, especially with the new cases that have been announced today. Thank you once again, guys, for coming. Gentlemen, Dr. Rudi Eggers, Dr. Philip, and Alfred, I thank you for coming.
Chairman, National Nurses Association of Kenya,
thank you
not
so
Council.
Much. Yes, Chairman, National Nurses Association of Kenya. Thank you for that correction. Let me start with you, Dr. Rudi Eggers. Give us, today we saw reports that the virus is almost topping, or the number of people who have died from the virus topped, or they are almost getting to 6,000. We're talking about 142,000 new infections. Maybe you can give us a global perspective of how many cases have been reported, considering that Kenya did report 2 more cases today. Yeah.
Well, thank you, Purity. Yes, you're right. 142,000 cases, at least at the moment in the world. They're not new cases, so this is the cumulative total of all the cases, and more than 5,700 deaths. We know, of course, that many of the original cases are already recovering. So this is not the total number of people that are still ill at the moment. But still, day by day, it's getting a lot more. And in some countries, it really is quite explosive in the way that it is increasing. So as you mentioned a minute ago, WHO declared that Europe is the new epicenter for this disease. So when we last spoke in February here about this disease, more than 99% of the cases were all in China. Now we have more than 25% of the cases outside China, and Europe is by far the highest. Both countries like Italy, Spain, France, Germany, all of them are exceeding day by day the numbers. We also have increases in countries such as Iran and the USA. So all of these countries really have overstepped a threshold where suddenly the disease is taking off.
Yeah.
Some countries such as Korea have already reached seemingly the top of their outbreak curve and are starting to have a decline, like China itself as well. So in fact, in China these days, there may be 40 or 50 new cases a day, whereas at the peak it was more than 4,000 cases, new cases per day. So it seems that in some countries the strategies that they've used have paid off, and they are starting to get a grip of this disease.
Yeah, and Doc will tell us what these other nations are doing, especially China, to reduce the number of cases being reported. Dr. Philip, let me welcome you to the program, because you are the coordinator for this National Influenza Program. Of course, it is a program specifically for dealing with cases of coronavirus. Talk about prevention and also handling those cases. Let's begin with updating us on the latest that we have, apart from the 3 cases that were confirmed today, or 2 more cases, of course. The other one was confirmed last week, this week on Friday. Apart from maybe the 2 cases and the others who are in quarantine, tell us what more that the nation need to know as far as coronavirus is concerned in Kenya.
Thanks a lot, Purity, for calling us into this program. We want to enlighten the population of Kenya that despite the fact that we have 3 cases which have been confirmed, and a total of about 20 contacts, we are still, we have our machinery on the ground, and we have actually heightened training of all sectors of the Kenyan population. Tomorrow we'll be actually sensitizing the matatu operators in Nairobi. We are going to camp at the railway bus station, country bus station, tea room, and the bus terminus to educate them on how they should conduct themselves and how they should take care of the people who are getting into their transport sector. Then we will be actually training healthcare workers from the Red Cross, who we expect to go and roll out the training to the rest of the healthcare workers and volunteers for the Red Cross, because we know at times of this, events like this, the Red Cross comes very much in ante to support us in reaching the common man at the grassroots level.
Yeah.
We are also training the St. John's ambulance next week, so that we can also train in turn their volunteers together with our people, so that at least at the ground level, we have people who can actually detect these problems.
Yeah.
We have trained close to 1,500 healthcare workers now, mixed doctors, nurses, clinical officers, laboratory technologists, and moving forward, these were just healthcare workers from about 16, 18 counties. We want to cover the whole county. Of course, some of the counties we did what we call sensitization, which will give you a glimpse of what is this problem, how should you tackle it, and what should you do in case you suspect a case.
Right.
So most of the healthcare workers across the whole country have that bit.
Yeah.
But the bit which we want now to concentrate on is telling them when you get a case, how do you behave yourself as a healthcare worker, and how do you take care of the patient so that you don't infect yourself, you don't infect other care workers, you don't spread the infection within the community.
All right. Before I speak with Obengo, maybe Dr. Philip, you can tell us the mandate, the specific mandate for this influenza program. What are some of the key highlights? Probably we could start from there so that we understand what this program is covering as far as preventing coronavirus is concerned.
Okay. The influenza program in Kenya was started back in 2006 when we had the global scare of avian influenza. And that is when we started the influenza surveillance in this country. And it's from that time we started detecting influenza circulates the year round. From that, we got the H1N1 pandemic in 2009. This is the same program which was also take care of this. Now that we have got this emerged respiratory pathogen, COVID-19, we have developed, actually not, the influenza program is not the one which is leading, but it's the National Task Force. The National Task Force on COVID-19 is the technical arm of the steering committee, which was put on board by our excellent, the president. So what this task force does is to prepare the country in terms of preparing healthcare workers, developing messages for different sectors of the Kenyan population to enlighten them on what is happening across the globe and what they should do to protect themselves, protect their loved ones, and protect our country.
All right.
Yes.
And so the key highlights for specifically, because I do understand you're working with the National Response Committee on Health on coronavirus. So what are some of the specific key highlights or mandates that you're supposed to do at this time that the country is trying to prevent further spread of the coronavirus?
What we want to urge our people in Kenya, let's be our brothers and sisters keeper. In the local areas where we are staying, we know the movement of our people, like the Nyumba Kumi kind of approach. So if you get a neighbor who probably has traveled out and start getting signs and symptoms, it's good to advise them to seek early medical care and give their full history of where they've been, and the healthcare workers will be able to discern whether they are contact or they are not, and if they are at risk or they are not. If we can get this approach at every 10 households, we will be able to detect most of the cases early and manage them.
All right.
Not when infectious problems are detected early. It's easier to contain them and manage than when we wait until a lot of cases are there and the spread has already engulfed a large portion
All right, I'll
of the
get
population.
back to you, sir. Alfred Obengo, you are the chair for the National Nurses Association of Kenya. Yeah, and Dr. Philip mentioned about the trainings for health workers. Probably you can just tell us, even for health workers, what is what kind of preparedness that health professionals in the country have in regard to this new virus that is affecting the globe?
Oh, thank you, Purity. I'll start first by acknowledging and appreciating the measures that have been put so far by the government of Kenya insofar as preparedness, response, and mitigation of this deadly virus. As the nurses of this country and the general healthcare professionals, we promise to support the government initiatives because we are in this thing together. And that's now where we come to even issues of training, because we know the government cannot achieve this if they don't support us and we don't support them, because we are the people on the ground. Apart from the press releases and public pronouncement, the action actually is where the rubber meets the road, and that is the clinical environment. And when you talk about the clinical environment, that is where the doctor is, the nurses are, and the laboratory and other clinical officers and health professionals. In training in this matter is of utmost importance. In fact, without training, our people are incapacitated. And apart from training, now we go to the PPEs, the protective, personal protective equipment. They must also be provided. So far, we can say that we are satisfied with the measures that the government has put in place, and especially Kenyatta National Hospital, where we have the patients. But as we endeavor to protect and sensitize the public and reassure them, we also urge the government to do the same also to the caregivers. Yes. Let them not forget the caregivers.
Right.
We also need counseling and other issues that I'll talk about.
Yeah, you will talk about that. So, Dr. Rudi, the last time we had a conversation with you, WHO had not actually declared coronavirus as a pandemic, because we were only talking about China and a few other countries. But right now, we are talking about now Europe being a new epicenter for this coronavirus. First, let us understand what are some of the issues that nations are not doing. You know, where exactly is the gap? Because it started in China, sir. It started in China, and then it actually stayed in China for some time before crossing to Africa. But then in Africa, it spread everywhere. And you are saying it's now a pandemic. Let's talk about the gap. What are we not doing? Are we not, as nations, following what your recommendations, WHO recommendations, or where exactly is the problem?
So in fact, China did quite a good job initially of containing the disease, and that's why we had a very slow spread initially. But of course, this disease, by virtue of it being a respiratory disease, actually transmits easily from person to person, and as soon as people travel, they actually do transmit it. And we've seen it over and over in other countries, that you get the initial few sporadic cases imported, and then local transmission takes over, and that's when you get the explosive transmission. Countries have been, as far as they can, trying to contain that, some more effective, some less effective. But at the end of the day, there are two components to this prevention. So the first component is the personal component. So we talked about that last time. So what individuals can do to actually prevent themselves getting infected is basic hygiene. The washing of hands is very important, because that is how you touch things and you touch your face, and that's how you get the virus onto you. Sneezing and coughing, of course, you need to prevent that spreading into the room, and that is done by coughing into the elbow or into the tissue that you can throw away. Staying away from people, having some distance from people, so that there is less opportunity to become infected. And then if there are people that are ill, that they are actually isolated and kept apart. So that's the personal environment, the thing that individuals can do. What His Excellency the President announced tonight was the second component, which is a governmental response. Things like banning of large meetings, reducing people coming together in church services or in schools, reducing travel. These are structural changes that are very, very important, and we've seen them work in China and South Korea and other countries. So they are quite critical in the control of this disease, especially at the early stage. The intent here is really to slow down the disease. As soon as you've got community transmission, it's unlikely that you'll be able to contain it. So as soon as community transmission takes hold, what you're trying to do is really to slow down the disease so that even if you spread it out over a longer time, you have less people at every given time that are infected and that need care. Because otherwise you overwhelm the health system.
Yeah, and when you talk about community transmission, what we're seeing in Kenya, from the pronouncement today, these 2 cases had contact with the person, with the first case that was announced here in Kenya. Is that what you mean when you talk about community cases? And actually, what does it mean when now the disease is now community-based and not anymore about people coming from abroad and then they are positive and trying to spread the virus to others?
So the initial case, of course, is what we call an importation. They contracted the disease outside Kenya and they came into the country with the disease. The 2 contacts have got a direct link to this case, and that's what we call local transmission. So just direct contacts. With community transmission, what is meant is really once it goes so far that you can hardly trace the individual chains of transmission. It goes further than that. So we sort of in between local transmission and community transmission now. One assumes that perhaps there have been other contacts and perhaps there are other people infected, but that's really where the rapid response teams are really active to go and find cases, to find the contacts, etc. Once it is a community spread, then of course you can no longer determine which route of transmission it is taken.
That's where we are as a country?
Not yet. I think we're getting very close to that, but we're not quite there. At the moment, we would still consider it local transmission, but I think the likelihood for community transmission is quite high.
All right. And Dr. Philip, let me ask you this question. Did we as a country have an opportunity, because it's being announced months after it was first announced in China, did we as a country have the opportunity maybe to prevent the spread of this virus, or you'd say it's an unfortunate incident that has happened?
What I can tell you, with the kind of interconnectivity which is across the world and people moving to different parts of the world for trade, for education, for all sorts of business, it would be difficult to curtail the incursion of such a problem into Kenya. Kenya being a travel hub in Africa. So the only way probably you could have prevented that if when you get the first cases in China, we did blockade of the whole country of Kenya, which is not possible. We have what we call the international health regulations, which guides the international community on internationally transmissible infectious problem. And countries make their decision using that guideline. And that is the guideline we were using when we heightened surveillance at all our points of entry and within all the health institutions in Kenya. That is the basic, the bottom line. You heighten your surveillance at every point and inform all the healthcare workers of what to look out for. Because we are a global community and we cannot close ourselves onto ourselves only.
Okay.
Yes.
Alfred, you mentioned that the government is doing a lot, especially to protect patients and people from getting this virus. And then you said there is something they need to do. Maybe they have forgotten or something about the health workers, health professionals who actually should be interacting directly with any suspected case. What is the challenge with the health professionals?
As a leader of nurses in Kenya, we are also in communication and in solidarity with our colleagues globally. And we share information of whatever measures and they're undertaking in their own countries, China, Italy, Singapore, and Korea, and others, and many others. we are also, as health workers and nurses, we are also supporting the government insofar as lessening the panic is concerned. We don't need to panic at this time. All you need to do is to come together and combat this challenge as a country together. That one, we are so much with the government. Having said that, when I come back to the nurses and the health workers who are taking care of the patients, there are specific measures, because this is not a normal phenomenon. This is an extraordinary situation which must also be managed extraordinarily. Our people who are taking care of these patients, whether it's at a clinical environment, we also need to take care of them, just like whatever is being done to the others internationally. So these are people actually who also have their families. They are worried that when they come from the clinical environment, they go back, because they have to go back home. You cannot detach them from their families. What will happen to my children, to my husband, to my relatives? Am I supposed to mix with them? Or, things like that. So they need to be reassured also. Just like we are counseling the public and we are educating the public, we also need to educate the health workers. They're also human. Further to that, you find that the magnitude of risk that now we have exposed these nurses and other health workers, it's very high as compared to any ordinary situation. So that means that the government must also take measures to ensure that if they don't provide a special, they need to provide a special insurance for these health workers that are working within that clinical environment, specifically that clinical environment. And apart from that, it's also good to enhance things like the risks that the allowance that they are paid because of the exposure that they have. That does not say that we are not thinking about the public and the patients that we are attending to. Actually, our main duty and obligation is to save lives, apart from the other issues that I've talked about. But now we are handling a very extraordinary situation whereby we also need some incentives. But all in all, we remain supportive of the government measures and guidelines.
Right.
And we are prepared even to go further to work together insofar as sensitization of the public is concerned.
All right.
And we have the capacity. Yes.
Sir, before I ask you what China is doing, because recent reports, it's that it's actually almost going back to its normal operations because they have been able to minimize new infections and contain the virus. But just before that, in regard to what Alfred is saying, maybe you can shed more light on how health professionals, especially people who are caregivers, health professionals, how they should protect themselves, how they should be protected by their own governments to just ensure that they also, the fact that they are at a high risk of getting the virus, but how can they be helped?
Well, certainly the first step is knowledge, being aware of how to do it. So that is critical, and that's why the training that was talked about a minute ago. So both the frontline health workers, the first health workers that people come in contact with, they should have very basic but very clear knowledge and clear guidelines and instructions on how to deal with it. And then, of course, the critical care doctors and the people that really take care of people over a long time. So the first thing is really about knowledge and understanding and doing the right thing. The second thing is having the right equipment. So I'm sure you've seen on the TV the people that have the masks, but then also the suits, etc. So that is the way that once they have positive cases, that they actually make sure that they are themselves protected. And of course, WHO and many of the countries of Africa have got some knowledge of this. They've been responding to other outbreaks such as Marburg in Uganda or Ebola in DR Congo. So there's some knowledge on how to do that quite well. At the same time, those kind of commodities, of course, now are becoming scarce, because the whole world is needing them. Everybody is wanting these kits. So it's really critical that these kits are kept for those health workers that truly are in direct contact and care of those cases. So there's a very fine line of making sure that the health workers that are responding have the right kit, but we're not wasteful with it. We use the kits appropriately.
All right, so let's talk about what China is doing. It's almost going back to its normal operations. We are seeing Europe actually being the new epicenter for this, and the virus is spreading. We now talk about coronavirus in Kenya. We have 3 more cases. What is the secret? Because they are almost eliminating the virus.
So China, of course, did go into quite a severe lockdown. So they actually restricted movements of people quite severely. And I think that has been the key in that country to actually slow down the disease. Similar has been in South Korea. So those countries have managed to actually restrict the movement of people, keep them apart. We call it social distancing. And that is really effective in the severe outbreak situation to slow down the disease. We must say, though, that in China the problem is not finished. It's still there. And in fact, they are getting now importations of cases from other countries. In fact, now China has less internal cases than actually importations. So that's the other thing we should learn, is we should be careful to let down our guard at this stage and say the disease is gone, we don't have a problem, when in fact it's still there, and you still have to be able to make sure that it doesn't continue to spread. Remember, in China we have 60,000 cases, so that's a large number, but there are many, many people that have not been infected, and in fact potentially could still be infected. So we shouldn't let down our guard even when the cases go down.
Yeah, and in Kenya the first case was an importation case, yeah, and that is what is happening in other countries. It was started in China, spreading all over the globe right now. So what do we need to ensure, because Dr. Philip said Kenya is a tourist destination, you know, it's a traveling hub. So what do we need to just ensure these importation cases are minimized?
Well, I think as the announcement was done this afternoon, I think the restriction of travel into Kenya, and those that truly have to travel, that they actually remove themselves from society for the 14 days, is actually quite a wise move at this stage. Because you can no longer be sure where the case will come from. Originally we had a very clear idea most cases would come from China, but now in fact they can come from anywhere. There are many countries that have got this disease. So this restriction that's being put in place by Kenya is actually the appropriate next step to actually make sure that it doesn't explosively increase in Kenya.
Yeah, and Dr. Philip, a week ago we were talking about preventing importation of coronavirus into the country, but right now it's both importation and community spread, because there are people who are in contact with, but of course we've not exclusively identified all of them. It's just the known ones. So what is the change of the program? Do we have any changes that we are now seeing, that we have now 3 more cases, and actually 2 of them are not imported cases, they are a contact case? You know, what are we looking at as a nation to just ensure that these now 2, of course they were in contact with other people? So do we have any change, drastic change in the influenza program, the national, you also work hand in hand with the National Committee on Coronavirus Response? What are we seeing as we move forward?
Basically, what we're going to be doing as a task force and as a whole country is to still continue with the heightened surveillance, and with the realization that even that one case which was realized as an importation, there may be others who passed through the airport undetected because they were asymptomatic. So we are not going to relent and say we have trapped the only case and probably the only conduct. So we are actually going to intensify our surveillance and request our healthcare workers to be more vigilant in identifying any more cases in the coming days and weeks, so that at least we can mop up any other new cases who may be within our communities and may start showing signs and symptoms at this time, so that we can isolate them, treat them, and manage the community spread. What we have now is not actually even a community spread, it's a localized spread within a small cluster of Kenyans. So we are not going to change any perspective, we're just going to strengthen and heighten what we have been doing, so that we net more of these people.
Yeah, and Mbagathi Hospital is an isolation center. This means that people will be brought there if they were in contact or are coming from a high risk Yeah, or say before they are confirmed to be positive.
Okay,
So what happens when, like for example, for the 3 cases that were confirmed to be positive, are they still at Mbagathi Hospital or where are they exactly?
Okay, Mbagathi currently is being used as a sort of a quarantine.
Yeah.
The Kenyatta Infectious Diseases Unit is the isolation where we are managing the confirmed cases.
All right.
So all those contacts who were rounded up for this one case were brought to Mbagathi as a temporarily quarantine and for more tests to be done. So for any further contacts which we may identify will be brought to Mbagathi for safekeeping, education, and testing whether they might have been infected. What I want to say is, apart from Mbagathi, Kenyatta, we have other health institutions who have set up isolation facilities across the country. In Kenyatta University Hospital, we have close to 100 capacity isolation beds. And in Aga Khan Hospital, we are going into a memorandum of understanding with them as a government in case the equipment we have in Kenyatta and Mbagathi are outstripped by the number of cases so that we can even take patients to Mbagathi. Then we have other 25 counties who have set at least 10 beds capacity isolation facilities in Kenya. So we are prepared for this. We are not praying we are going to get any more cases. We pray the cases we're going to get are going to be detected in count A, B, and C and managed there so that we can avoid that spread when we are referring the patients to the national level.
Mm-hmm. All right. So Alfred Obengo, at community level, because this is not just a Nairobi issue, we also have county governments, we also have community health workers, community health facilities. What kind of preparedness do people at a community level have? Because most of these are actually volunteers.
We've just heard from the WHO expert that we've not reached that community transmission, but we can reach there, but we must not reach there. We must not reach there.
Yes.
And the only way that we must not reach there is enhancing the education and sensitization of preparedness and prevention. And I want to urge the government, and also with the help of WHO, let us expand the bracket of educating and the health workers, the community health workers, extension workers on the preparedness and prevention. I listened to the DG the other day. He was saying that they had to stagger the training because they cannot train everybody at once because some must work. You cannot take everyone from your workplace to train them. Having said that, we need to develop other new strategies of training people. You can even train them where they are. We can explore issues like online portals and training so that we capture so many people as much as possible. And this one we are saying as a professional association that we are ready to work with the government so that we can cover as many people as possible, especially the health workers.
Yeah.
Actually, because awareness and knowledge is the best tool to fight this disease.
All right, Dr. Muthoka, you have something to say?
Yes, what I want to say is we need to use the existing structures for which are being used by the community strategy. We have the event-based surveillance, which is very good, and we have symptomic and late case definitions for severe acute respiratory infections, which this problem at the tail end of it presents with severe acute respiratory infection. But before we get there, our community units should be able to detect any clusters or any cases of acute upper respiratory tract infections, and being each brothers, your brothers or sisters keeper, know and advise them to seek early medical attention and give their full travel history or their full connection of contact in case they may have come into contact with somebody who had traveled to one of the countries where we're having increased cases like Italy and any countries in Europe. The other thing I just wanted to add on a question you asked Dr. Eggers about what you're seeing in China and what is happening in Italy and what is happening in Kenya and the rest of the world. If you look at an infectious problem, when an infectious problem is new, like this one, the whole of the entire population is naive or it has no immunity at all. So initially, this is what happened in China. We had a lot of people who are infected, and with time, a critical number of the rest of the population got some herd immunity. So that's why you're seeing now the numbers are coming down, because the infections locally are few. And that is the same thing which happened in 2009 when we had the H1N1 pandemic. A lot of new cases in the initial stages. In the next 3 weeks, the number of cases were skyrocketing. In the 4th and 5th weeks, they stopped dropping down. The good thing about the COVID-19 is that it is not a big killer. The case fatality rate is about 2 to 3%, just comparable to what is caused by the normal flu, which we get. So we should not be so scared. What we need to do is to be cognizant of the fact that in the initial stages, when we start getting community-acquired infections, a lot of us are going to fall down, very sick. But within 5 or 7 days, we will wake up and continue. This will come in waves. So certain critical sectors of the economy may be adversely affected, but ultimately we'll wake up and continue with our work. Mm-hmm. So let's not be so scared. It's not going to knock us flat and we go. We are still here.
Okay.
And the best way to manage people so that they're not scared is to share the right information.
Yes.
It's very, very important.
Okay. Dr. Rudi, what works for Kenya now that we have cases, an importation case, and then, of course, people who are in contact? Today, the government suspended, of course, the flights from especially areas that have reported cases, and then we've also seen that some schools will be closing from tomorrow. Is that all, or what works for Kenya moving forward now that we have cases?
So I think that's exactly the right move that the government has announced now. So they are both curtailing the importations, so you're making sure that you don't get more and more importations. But very importantly, because the disease is now present in the country, is making sure that it doesn't spread very quickly here. So things like the closing of schools, of other institutions, asking people to stay away from entertainment or those big events, that's exactly the right approach. And in fact, you asked earlier, well, what should Kenya be doing? This is exactly what Kenya should be doing. They should stop people from moving, and by keeping people at home, both the people that can work from home and scholars and students, that is exactly the type of reduction of mobility that actually reduces the spread. I think it's very likely that community spread will go on. So I think we should anticipate that we will have more cases. I don't think we're at the end of this. But what the government just did actually puts a damper on the ability to spread rapidly. And I think we should also be very conscious that any place where people are clustered together, and this includes public transport, it includes churches, it includes school events, all of those places are really the place where that transmission will take place. So if we in any way can remove ourselves from the situation, I think both the person will be protected and actually the spread to the community will be reduced.
Yeah, and there are other countries that have not mentioned or reported any case. For them, what should work to just ensure, because they're looking at no importation of coronavirus cases. Maybe you can also help them understand what they should be doing. Should they do what, for example, Kenya has done or other nations have done, preventing or restricting movements, especially on people who've traveled or planes from countries that have reported cases? What exactly should they be doing?
Well, I think because it's a pandemic, it is very likely that ultimately all countries of the world will be affected. So I think we should envisage that all countries ultimately be affected. So this time period, like Kenya had about a month and a half, 2 months time period to prepare, which was wonderful. It was very helpful to actually have this time to think through plans, to set up Mbagati. All those things were, had it been an immediate explosive outbreak in Kenya, we would have been much less prepared. So these countries that currently don't have cases should use this time to prepare properly, to get their plans in order, to get their beds, their health workers, the training, all those things ready. They can try and prevent the implications as much as possible by also reducing the travel from affected areas. Ultimately, I think every country will be affected, but I think countries can very much use this time that they have now to prepare and to avoid this importation.
Yeah, and as Dr. Eggers is saying, we had 1.5 months to prepare. Again, are we prepared?
We are prepared. As a country, we are prepared. As we are seeing the cases we got, we were able to detect them, and we are managing them effectively. As far as any health standards are concerned, we are doing wonderful. And we are prepared because we are getting healthcare workers from as far as Lodwar, even bringing samples for testing at the central level, which means the whole country is aware and we are on the lookout. Yes.
And there's the issue of the price, the cost of, especially of the sanitizers, because that is one of the recommendations that people should be regularly washing their hands with soap or water, and of course using sanitizers. But there is an issue with the cost for this.
Actually, what you should realize is not actually only a matter of the cost.
Yeah.
We should also invoke and make sure KEPS comes on board, because you're going to get a lot of fake sanitizers in the market. And I am urging the public, if you're buying any hand sanitizers, make sure at least it has 70% alcohol. And make sure it has a KEPS mark. Because you're going to get a lot of sanitizers being tapped from every place. About the prices, that is a policy issue, and I believe the government is going to look into that and to see how it can actually give the population of Kenya an accessible and pocket-friendly sanitizer through engagement with them, the manufacturers.
And Dr. Muthoka, we are winding up. Maybe I'll just ask you once again to say your parting shot as we move to Alfred and
Yes,
Dr.
okay. My parting shot is to the people of Kenya: please don't panic, be calm. Please, if you travel to any of the countries with the widespread COVID-19, and within the 14 days of having been there, or having come into contact with a person who was there, you start getting signs or symptoms of upper respiratory tract infection like fever, cough, sneezing, or feeling unwell, please report to the nearest health facility, report what you're feeling, and give your travel history or your contact with any person who may have traveled to one of the countries where these infections are. And let's be our brothers and sisters keeper. Let's help each other to contain this problem through adhering to all the messages of hand hygiene, cough etiquette, and social distancing.
All right, Alfred.
Before I make my final comments, I'll just appeal to Kenyans, and if they can't do that, probably the government should come with some measures so that we be a little bit civil enough. Don't buy more than you need, so that you leave also others to buy whatever. It's like I'm here, people are over shopping. So if you take them all and the other person who is next,
your
neighbor doesn't get, you have not protected yourself.
He's going to be a threat.
It's going to be a threat to you. So don't buy more than you need.
But there's a fear.
Just enough.
Okay.
This is a process of managing the same fear.
All right.
Because if you buy more than you need, you're putting yourself into more risk. Because if your neighbor misses, you're still at risk. So you'd rather all of you have the sanitizer so that all of you are safe. You're safe. You cannot be safe as one person in an environment where others are not safe.
All right. And Dr.
Lastly, I want to say that as health workers, as nurses, we are in solidarity with the global citizenry. We are in support of the government measures that have been put in place. We'll continue supporting them. Most importantly, we want the trainings to continue. That is paramount.
Yeah.
So especially if we have to prevent the community transmission.
Yeah.
Trainings.
And Dr. Eggers, as I welcome you to maybe say your parting shot, I would also seek a clarification on quarantine centers. There are quarantine centers, so who exactly is supposed to be at that center? Because there is also the issue of self-quarantine. Yeah.
So the quarantine centers are meant to take people out of society where you are unsure if they are infected or not. So mostly these people will be asymptomatic, but they might have been in contact or in some situation where you suspect that they will become diseased. So you take them out of society in that period where they might infect others, and you watch them. Should they become symptomatic, of course, you would test them and then assure whatever treatment is needed. So that's the central idea of quarantine. The self-quarantine is the same idea. It's just not in a center, it's in your own home that you would do that. And I'd like to reinforce what Dr. Muthoka said. I think the government is putting out the right messages. I would call on Kenyans to listen to these messages. They are good messages. The personal protection, the hand washing, the removal from society, the distancing are all correct messages. And then just one parting shot. At the end of the day, those health workers are your friends.
Yes. Yes.
They truly are going to be the people that will save the individuals that become ill. So let's see them as friends. Maybe let's thank them also, because they're going to have a hard time now to actually treat everybody, and they truly will be our friends to make sure that Kenya is safe.
And lastly, do we have any breakthrough as far as getting a vaccine for coronavirus is concerned?
Vaccines take a while to be produced, so it's unlikely that in the next 6 months or so a vaccine will be available, probably even longer. Ultimately, we know that this disease potentially can stay for longer. So even though countries like China, etc., have a decline already, it's thinkable that this disease will continue for half a year. And then, of course, vaccines and those kind of things will be important.
Yeah. All right. Thank you so much for your time, Dr. Rudi Eggers. Thank you so much, from the World Health Organization representative for Kenya. I'm glad you found time for us. Dr. Philip Muthoka, asante sana for your time and for coming. I know you've had a really a tight day today, but thank you for finding time. And also Alfred Obengo, I know you're working around the clock to ensure health workers are safe out here. Thank you so much. Maybe we will continue this conversation as we move on, because it's a virus that, like Dr. Rudi is saying, will stay for some time.
True.
Yeah. All right.
True.
Thank you, gentlemen.
Thank you.
Thank you.
All right. Thank you for watching our show tonight. My name is Purity Museo, and Baron Nabuli has been our sign language interpreter tonight. Thank you so much for your feedback. Time is not on our side, but I'll be having a look at them off air. Good night and God bless.